Hi, I'm Dr. Shel. Have you ever wondered why so many people in this country are being diagnosed with IBS, inflammatory bowel syndrome, irritable bowel syndrome, colon cancer, and many such things that relate to the digestive tract? There is one major culprit for all of these issues, and that is inflammation. Inflammation begins in the digestive tract and in the gut, and it causes symptoms such as bloating, gas, constipation, diarrhea, abdominal pain, fatigue, brain fog, headaches, so many different symptoms that you may not think relate to inflammation, but they all do. And we might ask ourselves, well, why do I have all these symptoms? Or you might say, well, my bowels have always been very slow to move. Or you might say, I've always been irregular, and you just accept it as a part of life. Well, you no longer need to. You can have a very healthy gut, get rid of the inflammation, and really prevent actual diseases and decrease your chances of colon cancer in the future. The way that I initiate this care with my patients is we educate our patients about food sensitivities. We're not talking about food allergies where you end up in the emergency room after, say, exposure to peanuts or other things you might be allergic to. These are food sensitivities, and in my practice, 80 to 95% of my patients have food sensitivities to several different foods, and it causes a great deal of symptomatology. We like to start with checking our patients with a simple blood test which tells you out of the 96 or over 300 different foods, whichever panel you want to check, which foods are you sensitive to. So you might think to yourself, well, I eat healthy and I eat spinach, or I eat different kinds of vegetables or apples or other things, and I should be good. And it may be true that you might be sensitive to those very foods that you're eating that may be considered healthy, but they might not be healthy for you. So consider getting a test done for food sensitivities to be able to see what foods are triggering an inflammatory process in your gut. Once you know what those foods are, you eliminate those foods from your diet, and some of the more common ones are, of course, gluten and sugars and yeast and dairy and soy and corn and eggs, but you really need to know what your specific sensitivities are. Perhaps consider doing our detox kit to detoxify your body with this toxins, getting rid of those, and then introduce probiotics, but medical grade probiotics, digestive enzymes, and protease. So let's get you on the road to a healthier gut, less inflammation, and complete health and well-being in your digestive tract. Give us a call or log on for a complimentary consultation. Just send us an email and we'll be happy to help you.